demonstrate the use of a rigid plastic fluid bottle, catheter line, and a fluid pump. The first step clearly is to open your Venacet, pull it out. This is exactly the same Venacet system that you would use with a soft-sided fluid bag. You'll see that it does come with a very pointed insertion end. The rigid fluid bottle has a protective metal cover. What is from the factory? To use this, you're going to actually flip the bottle over. This is the tab that's going to hang the bottle from the pole. You flip that up, put it back down, then the top of this bottle is covered with metal. You see it scored right here. There's actually an easy place to just flip that open. You don't want to pull it off or remove the entire top. You're merely going to flip this up. If you look at the end of it, it's actually shaped like a target. You have a pointy end, you have a target. You're going to put the pointy end in the target. Once you've inserted the spike in the rigid bottle, you're simply going to invert the bottle, bring it to the pump, place it on the pole, and then run your line through the pump just like you would if you were using a soft-sided bag. The advantage to using this system, and in my mind, is that you get every single drop of fluid. It's good to the last drop. You're not wasting 50 mils or 30 mils at the bottom of your soft-sided bag. So today we're demonstrating the use of this rigid plastic bottle through the IV line, through a pump, and then being administered directly to a small breed of dog. The rigid bottles work fantastic. Here then is an example using a rigid bottle, a vented IV set that comes down to the dog, simply using gravity flow. As you can see, the fluid rate is very similar to when you're using the soft-sided plastic bags. And of course, gravity flow is adjustable here. So now we're going to demonstrate how we also don't want to open this bottle. The rigid top, the lid, you pop open. You see how when you pop it open, there are lines that almost make you want to pull it off. If you do that, open it here, some technician is still going to want to hang it up like that. You'll still be able to insert your line, and then somebody's going to come along and try to push it. It's going to leak. Eventually that's going to pop off. So this is what not to do. So this is a rigid bottle direct from the box. You can see that it's got a metal seal, a circular seal with, it almost looks like a little line that continues. We're not going to peel that off. You just want to pop that open, leave the metal piece attached, take the end of your line, the pointy end, and insert it right in the rubber stopper. It's no harder than putting it in your soft-sided flexible bags. And then everything else is just like you would use your old bags. In conclusion then today, I hope we've demonstrated the advantages of using rigid fluid bottles and IV administration, either gravity or a pump, in giving fluids to your patients.